Maria Hexo. Perfect. There she is. Reinsert a Foley catheter. So we're going to do that today. I'm just going to grab my gloves. I've done my table really quick so I've got a clean surface. Perfect. Okay, I'm going to gather the rest of my supplies. So I've got my gloves here, a catheter kit, and then a chuck pad. And it should be good to go. Okay. Hi, Maria.
Hi.
Got some hand sanitizer. How are you doing today?
I'm doing good, thanks. How are you?
I'm doing good. Okay. I am just going to check your wristband so I can get your name and date of birth. Want to go ahead and tell me what it is?
My name is Maria Hexo. My date of birth is January 19th, and it was 77 years ago.
Beautiful. Okay. Awesome. It looks like I want to just double check. You don't have any allergies, correct?
No.
Okay, beautiful. That's what it says on your wristband too. So we have orders in the EHR to go ahead and insert a catheter. Have you had a catheter before?
Yeah.
Okay, beautiful. So I'm glad you're familiar. I'm just going to explain the procedure one more time really quick.
Okay.
So it looks like you just came out of surgery, and with surgery we want you to have a lot of rest because that helps your body heal faster, which means it can be really hard to get up and go to the bathroom. So inserting a catheter will take care of your urine without you having to get up and go to the bathroom. Does that make sense?
Yeah.
Is it okay if you go ahead and perform this procedure?
Yeah, that's great.
Okay, perfect. I'm going to go ahead and pull the curtain for privacy. And I am going to lift your bed up really quick to a height that fits me. Old-fashioned way. Okay, perfect. I'm going to bring this a little bit closer to me. Set that up. I'm going to lower this rail. Perfect. Okay, we're going to go ahead and take the blanket down really quick. So it's going to get a little cold in here. So sorry.
It's okay.
But you're a champ. You've been through this before. Okay, let's close that really quick. I'm going to grab some gloves. Form hand hygiene one more time. The first thing we're doing is we're going to place a chuck down. So that way if anything leaks or spills, it should keep your bed dry.
Okay.
Want to make sure you're in the right position, you're on your back, and we're just going to have you lift your legs a bit too for me. That'll help us insert the catheter a little bit easier. Okay. Go ahead and lift your hips up for me. Perfect. Awesome. I'm going to go ahead and grab some wipes and do peri-care really quick. So we can keep everything clean. And I'll make sure to use a different part of the wipe each time. Okay, here we go. We'll wipe right here. Right here. Then one more time. Right here. Perfect. And then just gonna look really quick. There's your urinary meatus right here. This is where we're gonna go ahead and insert the catheter.
Okay.
So I'm going to remove my gloves and hand hygiene. And then this is where we're gonna go ahead and begin our sterile procedure. Sterile is how we keep everything extra clean. And so this means I'm gonna need you to try to stay as still as possible for me so we can keep this as sterile as possible, okay?
Okay.
paper so I can document later. I'm just going to open this up. I'm going to place it just by your feet. So we've got a little trash can on the bed for us. Makes our jobs a lot easier. And then I'm going to go ahead and open up my sterile kit. And then we have a sterile chuck and drape again. This is going to go underneath you. This is again to help keep the procedure sterile. I'm just going to grab gloves really quick. It wants to come out of the box. Okay, I'm gonna grab the border. That's coming apart. Don't want to separate that. Okay, I'm gonna let it. Make sure I have this shiny side down. So we're gonna go ahead and go. Perfect. Inch border. There we go. Okay. And pretty sure the drape touched her leg when I was unfolding, so that would be my first strike against sterile. So that's down, which is good. We did that. I'm just gonna remove my gloves again. And for hand hygiene, and we can go ahead and open this, and I'll put on my sterile gloves and we will continue on with our procedure. Too much heat sometimes. Those over there. Grab this. Like that. Okay, and I'm gonna go ahead and put on my sterile gloves next. Do hand hygiene one more time. Okay. Let's go ahead and open these up. Packaging does not like me today. Oh, there it is. Keep my sterile field in front of me. So I'm going to move my tray really quick. And then put on my gloves. Away. Okay, remove this. And I'm going to come back to my sterile field. And I'm going to head and just set up my supplies. Okay, put this out of the way too. Open up alcohol swabs. I'm going to put these here for a second, and I'm just gonna make sure that the catheter drain is closed. That way we don't spill anything. Perfect. So nose is pointing that way, so it's closed. Okay. I'm gonna put my alcohol swabs right here. And grab my sterile water and attach it to the port. Okay. I'm going to open up lubricant for the catheter. Drop that. And then we're going to go ahead and grab our catheter, and I'm going to be really careful as I open this, so that way we don't lose the end of it. Okay, and we're going to go ahead and just lubricate this a little bit, so that way it can be inserted easier, just a couple centimeters. And then we're going to go ahead and move that right there. These things are always a little tricky, so I set that down my tubing because it's all sterile. And I'm going to go ahead and move my sterile field over here, which is why we have the drape. So now everything can be done right here, and this is why, now this is my focus in my sterile field. So we're gonna go ahead, and with my non-dominant hand, I'm gonna open up the labia, and I'm gonna go ahead and wipe with the alcohol swabs. Outside, garbage. Other side, garbage. Middle, urinary meatus, garbage. Okay, and then this is where we're gonna go ahead and insert the catheter. So I just need you to bear down for me just a little bit as I insert. I'm gonna make sure not to touch it. So here we go, 3, 2, 1. Perfect, we're just gonna go in 2 to 3 inches. Keep going, hopefully we should see some backflow soon. Okay, and it looks like I'm seeing some backflow. So I'm just gonna go ahead and with my dominant hand, hold this. And I'm going to push in some water, about 5 mils per the directions. Okay, there's 5. I'm just going to check for resistance. Perfect, it's not coming out, so I'm just going to advance it another inch really quick. And I'm going to go ahead and grab this now and undo that. And I'm going to take off my sterile gloves because we got the catheter in, which is beautiful. Throw those away. Going to go do hand hygiene. Grab some more gloves. And now I'm just gonna strap the catheter to your leg really quick. I'm telling you, gloves are my biggest issue today, Maria. Okay, there we go. So we're just gonna go ahead and take this and attach it. Stretch it, make sure that that's gonna stay right there. Looks like we've got some excess. Just be careful as you're tossing and turning in bed when you're asleep. I'm gonna attach this to the bed frame, part of the bed that doesn't move. There we go. Okay, great. Just gonna check your urine output. Looks like we have about 100 mils right now, which is good. Gonna take my gloves off again. Hand hygiene, new gloves, and I'll get everything thrown away. We'll do some peri-care, and then we will get you back to bed so you can take your nap, which is what you asked for. Upside down glove. Okay. So let's get everything thrown away. Set this over here. And get rid of this for you. Then we can keep the drape out as well, just in case. And the catheters get drippy. Hand hygiene. Another pair of gloves. And we'll do some peri-care. Hand sanitizer and gloves. Don't know who thought of that one, but they don't work very well. Okay. Gonna wipe it up, wrap it up around my hand again. We'll make sure to use a different part of the wipe each time. So I'm gonna just go ahead and do some catheter care really quick. Make sure not to pull it out. And then I'll get another wipe. Okay. Wipe right here. This side. Down the center. Perfect. Some hand hygiene, and then let's go ahead and get you ready for bed. Gonna put your side rail back up for you. Gonna lower your bed. It's on red, which means the wheels are locked. That's the lowest position. I'm gonna hand you your call light, and I'm gonna go document the procedure in EHR. I'll be back in about 20 minutes to check on you and check on your output level again. But I'm glad I could help you today, Maria.
Thank
you.
you.
I'll do hand hygiene to leave.